other years, I would say do that. Talk about how you got crime down. This one.
Silence. All right, good evening, everyone. We're going to get started. There's a meeting following us at 7 p.m. So again, as I've been saying, let's try to keep things, budget and fiscally focused and move on through the night as fast as we can. Mr. Timniak, very helpful if you give us the page numbers as we go along. That have been said, I am reconvening the recessed budget workshop of March 20th, 2024, and turning things over temporarily to Chris Timniak.
Good evening, everyone. I just want to make a couple notes. I passed out the year-to-date report from Munis, which was asked for at the last meeting. I also passed out follow-up material from Tammy Trojanowski on the demographics of the town. One final note, I'd like to introduce Kimberly Casella, our Deputy Finance Director, who is going to be here in the absence of Dawn Savo. So with that, I will pass it off to Chief McNeil to run through his budget.
Good evening. So I hope you have all, if you want to just walk through it, I'll answer any questions. Anything increases are footnoted on the bottom of the page. They're all contractual, either equipment service or for the police union contract.
It's page 51.
Page 51.
Okay, so you're immediately open to questions.
Shoot away.
Thank you. Questions for Chief McNeil?
Through you, Mr. Chairman.
Okay, Ms. Sheik.
Thank you. Good evening, Chief McNeil. It's good to see you. Let me see. The last few pages of our budget book list the salaries for fiscal year 2025. Under Police Administration, the PAL Administrator, a non-union clerical position, is listed at $88,919, almost a $10,000 increase from fiscal year 2023, which was $77,923. On this page of the Police Administration total regular salaries for fiscal year 2025, the total is $558,183. Which job titles are included in the 5.0 listed headcount for the Police Administration?
That's myself, Deputy Chief Paul Dos Santos, Captain Anthony Rue, our Administrative Assistant, Marlene Vizcarando, and Aaron McLaughlin, who's the PAL Coordinator.
I'm sorry, it's hard to hear you.
Sorry. So I got myself, the Deputy Chief, the Executive Assistant to the Chief's Office, Captain Anthony Rue, and Aaron McLaughlin, who's a PAL Coordinator.
The PAL, sorry, Mayor Hoydick, you were referring to?
The PAL Coordinator, Administrator, whatever the title is, she's in the Supervisors Union.
That's correct.
The PAL Administrator? Is that what you said? Okay, so let me flip back. Sorry, just a second. Thank you. So the PAL, on page 70 for salaries, the PAL Administrator, the $88,919, that's listed with the description code, I guess, of a CLNU, and in the key that is described as the clerical non-union. Is that a mistake? Is it a union position?
That's a clerical error. The position was put into the union, and it was not updated on that. So it is a union position.
It's a union position.
The PAL Administrator.
Thank you for the clarification. Can I ask another question? Unless there's any other questions?
No, go ahead, Ms. Sheik.
Okay. The mayoral appointment non-union position for the public safety director, salary of $107,079, included in the regular payroll line item. but you answered that question. It's not listed as part of the police administration salary. You didn't read that off.
That's my salary, and that's in with Chris Timiak in the CAO line item side.
Oh, okay. Thank you for that clarification, Mr. Ciccarelli.
Any other comments for Chief McNeil and/or Larry Ciccarelli? Go ahead, Mr. Green.
Through you, Chair. For the line, we're on page 51 still, ending in 6009, which is the supplementary payroll. I see this year 34,655, which is flat to last year, but I do see, looking back, there's a good amount of volatility, and in 2021 it was only 15,000. It spiked, it's come down, and it's stabilized. What's the reason for that volatility over time? What's driving that?
That's a cash out line, so officers can cash out holiday credits, comp time, and when an officer leaves, all their cash outs come out. So if you have a retirement, you'll see that number really spike up.
That makes it volatile. Okay, thank you. Makes sense. The other question with PAL, I know you had a retirement in the PAL program, Lieutenant Eller. Is that position still, is that position in this budget, and is it going to be filled? Has it already been filled?
Well, he was a lieutenant, so we replaced him with a lieutenant.
Okay.
So we did not replace the PAL position, but the sergeant still, Sergeant James Lofton, he's still with the program.
Okay. Thank you.
Through the chair.
Go ahead, Ms. Whittam.
I just wanted to compliment you for keeping your budget flat besides the contractual salaries.
Thank you.
Ms. Gibson, and then Mr. O'Neill.
Okay, good afternoon. Thank you, through you, Chair. I just wanted to know, thanks for all the great...
Can't hear you.
Can you hear me? Oh, it's way up high. I'm sorry about that. Good afternoon. Okay. Can you all hear me now? Okay, thank you. Sound check. Just wanted to know, did the department receive any surpluses, or were there any deficits with the changes?
I'm sorry, can you repeat that? I didn't...
Any surpluses in the budget, or any deficits from this past year?
Well, I expect we're going to have a deficit this year because we're driven by events. So when something happens, it just drives and you can't really predict it, and it's random. Car crashes, we've had quite a few of them. Some are our fault, some not. It's just random, and it's hard to predict.
For that. Thank you for the answer.
Through you, Mr. Chair. My question is with regards to the PAL officers. It's not necessarily the salary, but what they do, their duties. It's my understanding that some of their duties, like as far as being out in the community, may have been cut. Like they're not going to be going out into the community like they were before.
No, that's not true.
Okay.
What we're doing is we're using officers that are working to swing by and take care of these things. It's still the SROs who are coming out of school are still going to be assigned to PAL. So everything's based on our manpower. I mean, we have a lot of officers in academy right now and out injured. So we're just hoping to get back in time so we can have them do that full time. But there will be officers there, and they're going to be there all summer. Actually, we're running a public safety camp, which will be run by them.
Yeah, because I just wanted to make sure that, what was started in the community with, the PAL officers engaging with the youth and, the people in the community, that it continues, because there's a difference between knowing the community and not knowing the community. If, as the officers have been, engaging with the community, they know the parents of the children, so if we get to a situation where, you have a police officer who may not be familiar with the community, and a child is running, what I'm saying, and, a mishap, stop, what I'm saying, and they don't stop, but police officer shoots, the difference is if I know you, you can go ahead and run. I'll meet you at your house and stuff because I know your mom, or I know your dad, because, that's working in the community, So I just want to make sure that community involvement, continues.
Well, if the officer says stop, and then shoots, we got a problem right there, so hopefully that doesn't happen. But, we have the PAL building, and that's gonna be better than anything we do right now, because you'll be coming to the police department with that interaction, with police department, on the police department policy, on department property. That's gonna pay great dividends. We're gonna run classes out of there, and that's what we're pushing for right now. The programs will still be on the outside, but we wanna bring them onto property. That's a big difference, and I think you'll get more bang for your buck from doing that. When officers come in, they get out of their car, go talk to the youth, see the families come pick up their kids. I mean, that's where you're gonna get the big benefit. That's the dividend. That's what we're working to. We're gonna be the only department doing it. That's gonna be a home run for us all.
One more thing, too, is that when you identify an officer to be involved in a PAL program, that officer's been vetted for, his communication skills and his interpersonal skills. So that's part of that process, too. So not anyone just can do it.
Right, exactly
And
right.
and we also have a football camp coming up. We got a soccer camp coming up. We have Public Safety Day coming up. So we're gonna be out there. We're not changing our focus, but we're gonna get bigger and better at what we're doing.
Thank you.
Mr. Fourier.
Through you, Mr. Chair. Chief McNeil, happy to see you. Just have to give a quick shout out to Detective Jason Delory for distinguished service. And my question to you is, does the mayor's proposed budget allow the police department to deliver the same level of services as years prior?
I'm sorry, I didn't hear that.
Does the mayor's proposed budget allow the police department to deliver the same level of services as years prior?
Yes, but, it's a lean budget. I mean, we're all understand that, costs of living are high, so we can't make any more demand. We got to live with what we're given, and we're going to do that. It makes us better efficient at what we need to do, which is find grants, find outside money, and also work with other task forces and bring them in to help us out in the community. So, working together, Bridgeport, Shelton, Bridgeport, I mean, we're not isolated here. We just got to get better at what we're doing. It's lean. We can work with it. Is it ideal? It's the best we can do. And we shouldn't be asked for any more money from anybody else.
Thank you.
Thank you.
I have a question.
Go ahead, Ms. Gibson.
I really do appreciate the police engagement program, and I was wondering if the budget included that, because that's been a really
Yes.
great program. Okay, thank you.
Matter of fact, we were just in the schools last couple of weeks.
Awesome, thank you.
All right, last call for questions for Chief McNeil. Go ahead,
Through you,
Ms.
Mr.
Sheik.
Chairman, just clarification, are we going through all of the police subsections? Is that what you're asking?
Yeah, I believe so. Is there
Or
a
just the-
different page you want to go to for further questioning?
Yes.
Okay.
I'll jump to Police Patrol, page 53. Last year, the head count was 70. This year is 70. It's proposed to be 73. My question is, in the description, does 73 include a full-time social worker in that 73, or are we able to have an additional 3 police officers coming onto the force?
It does include a social worker in the last 3 months of this budget year, but we're also working on a grant to cover that.
Great, so we have 3 additional police officers plus a social worker?
It's
Hopefully.
plus social worker, yeah, correct.
Thank you. Staffing ratios per shift. Could you describe to us what the shifts are and how many officers are, if there's a requirement or a minimal for that shift?
There is, by contract, there's a minimum manning, so, but we allowed 1 extra officer that we usually put on the summer onto 4 to 12 shift, which is then 4 p.m. to 12 a.m., just because that's when it gets busier. It's during the days in the winter because you get more accidents during the days. So that's how we just move it around.
Thank you. And in regards to your staffing and shifts with the increase of 3 officers, is that meeting what your staff ratio requirements are?
No, I think we're moving people around within the budget. If there were like, if you move someone from one division to another division, they're picked up in one. They were authorized 108. We're funded for 106. So if you count all, that's what we're dealing. We're dealing with the total number that we're moving around. They may move within divisions. We're not adding any new officers.
I'm sorry, so just to clarify, I was just asking about staffing ratios, but are you going back to the headcount piece? Is that what you're alluding to?
We're not adding any new officers. Like, we had a traffic, for instance, we had a traffic officer. He was just assigned to traffic. He's back into patrol to cover the shortfalls in the patrol division. Shortfalls because we have injuries and people in the academy. Now, it takes a long time, 10 months, to get someone through the academy and into manpower. Right now, we're probably at about 100 officers right now. I have an academy this Friday, 3 officers going in.
Congratulations, that is excellent work. So then that would, I'm not going to fully jump ahead, but the head count for the police traffic goes from 3.0 to 4.0. But on the police patrol page on 53, it goes from 70 to 73. So when I'm looking just at the head count numbers, those are not, except for the 3 that you just described, full new people, right? I guess I should be saying.
As of March 25th, March 18th, we moved the traffic officer into patrol. So the budget was put in before that. So it's just a timing thing. So we manage it by how much callback we have on the shift, and then we have to move people in to meet that need.
Thank you for clarifying that. I think that that's helpful as we're looking at all of this.
Mr. Freer?
Through you, Mr. Chair. Chief McNeil, I'm going to be citing page 52, Police Investigations, line item 014736302, specifically Equipment Services as it's titled. From the appendix, it says that the equipment service line increased, and this is crime scene mapping. I just wanted to see if you can explain what that includes and why the cost more than doubled from FY22 to FY25.
That's a good question. I've been asking the company too. It's called Faro. It's a laser that any fatal accident scene or very bad accident or a crime scene, you place this and basically shoots lasers, spins around, and it maps, gives you a 3D view of a whole crime scene, outside, inside. And you can go from, you can look at it from the top, fly over it, and we use it for evidentiary material. We send it to court.
Thank you.
Go ahead, Ms. Gibson.
Thank you. Through you, Chair. Chief McNeil, I'm going to cite on line item 014746009, the payroll supplementary of $283,000 and $283,628. Please explain the line item and what it constitutes when we say summary, the supplementary.
That's the cash outs we were talking about. You know, we break it up by division, so you got cash outs with anybody, comp time, holiday credits. Comp time's a big, it's a big cost.
Okay. Could you just say that again?
Comp time?
Comp time. Okay, yeah. For comp time.
So instead of getting money, they earn time. They can take it off or they can cash it out.
Oh, okay. Thank you.
Mrs. Whittam?
Through the chair. Just a quick question on page 50, the regular payroll. There have been no increase in staff.
Page 50?
Oh, different department. Yeah. Okay. That's it. I don't have anything.
Oh, not mine.
Good, Mr. Green.
Thank you. I am looking on page 53. And I'm looking at sort of, the breakout on that page of the payroll, supplementary, overtime, and callback. So what I see from 21 to this budget 25 is overall, basically the overtime pay, supplementary, special events seem to be fairly controlled over that period, trending flat or even downward in some of those cases. However, with callback, that's the 6024 line. It's risen over this period from 430,000 to 550,000. Can you explain callback and what's driving that increase?
Callback is when you have an opening on a shift, because an officer calls out sick, takes a vacation day, holiday credit, comp time, and you're at minimum manning. Let's say in the shift you have 8 cars, you have to have 8 cars on the road. Somebody takes it off and you're down to 7, you gotta bring someone back on overtime, time and a half to fill that car, that's a callback.
So this is overtime by another
Callback.
name, and
Correct.
to do with, I think, what Caitlin was talking about with shifts and staffing and needs. So is that something, it looks like over this time period, that's something that we're increasingly relying on and needing in the department?
Well, that's why we're trying to hire as many people we can. It's a timing issue. I can hire them, I just gotta wait for them. And that's really a problem. I mean, it takes 10 months to get someone into a car and fill in manning. And that's, it's a problem. And I think every department is facing the same issue right now. So departments like to take them from other departments, and we find that too.
Okay, thank you for that.
Mr. Frier and then Mr. O'Neill.
Through you, Mr. Chair, to Chief McNeil. I'm going to be citing as well page 53, specifically line item 014746008, special officers / event for $275,000. This is my first time, and I just want to get a better explanation. Could you give me a list of examples of what this is, and is this specified in the union contracts?
No, but it's traffic coverage for Memorial Day Parade, it's the July 4th celebration, it's all these special events that we have. When anybody has a parade, we gotta do traffic control and I gotta hire officers. Blues on the Beach, that's another big one. And we try to augment that with the police explorers, that helps. But we have to put people out there for the traffic control.
Thank you.
Yeah, through you, Chair. Chief, just a quick question to follow up with the callback. Is the number increased because of the fact that it's not more hours, but their pay increase?
That's part of it, yeah,
Okay.
absolutely. When they get a raise,
Right, so that's
cost goes up.
incorporated here, right?
Correct.
So
And
it's
that's-
not necessarily more hours, it's the
no,
same amount
You're
of hours,
absolutely
but
right.
just the pay increase
Correct.
is what caused it to go up. Thank you.
Mr. Glad.
Through you, Mr. Chair. And I don't expect you to have the answer to this right now. You can get back to us, but I think it's important to highlight the police department does a lot in the community for other parts of our community. So what I'm interested in finding out, because I know you're supporting it through PAL, through the police engagement program, through the SROs, through the social worker, all the support you're giving to our children inside and outside of school. And I'd like to, if it's some way you could give us a breakdown of really what that actually looks like as far as hours or dollars spent, because I think it's important to highlight how much the police department, and again, I'm not asking you to do that right here on the spot, because that might be difficult.
well,
Tim Yak can
we
probably
have
help with
looked
that.
at it. I mean, we were spending over $100,000 on it, with time and equipment and everything else, not equipment, but the training materials and the guy, but it was, it was substantial, over 100,000 easy. I think the last year's number was somewhere around 110,000.
Great, thank you.
All right, last call. Any final questions for Chief McNeil? Go ahead, Mr. Frier.
Through you, Mr. Chair. Chief, I'm going to be jumping to page 54, and I'm going to be talking about line item 014766399, outside service. In my appendix, it describes this as an increase in the projected building janitorial services and miscellaneous services such as illegal drug disposal and paper shredding. I just wanted to understand a little bit more how these outside services are utilized, and are they contracted, and what is really driving the cost if we take out the projected janitorial services?
Well, that's because we operate 24 hours, we got the police building, we got the animal control facility, so that's the two facilities that have to be cleaned daily. And it is contracted, and we really have any control of it. We put it out to bid. We thought we would get a price reduction. We did not. It just, the cost is what it is. I mean, to keep the place clean. I mean, it gets dirty there. We got a lot of people every day, 24 hours.
Thank you.
Go ahead.
Okay, Mr. Green.
Thank you. Also, on page 54, through the chair, I see the records department. I'm just looking kind of over the window from 2021 to 2025 at the top line, regular payroll. We've had the same headcount, 5.0 to 5.0, but the payroll regular has gone from 223,000 to 409,000. Can you explain sort of what
From
is happening there?
2021? I mean,
Yeah, fiscal year 2021, I'm looking at police records, page 54, the payroll regular for that department with 5. I have 223,000 there, and for this budgetary season, 409 with the same number of people.
well, last year was, what, 390,000?
Right, I'm just trying to
So
understand. I
it's just the
understand from
cost.
this year to last year,
Yeah.
I see that there was a big spike
Yeah.
before that and things have been flat.
Well, we didn't add anybody in records,
Well,
so
yeah, no,
it is what
it's,
it is.
right, it doesn't show an ad,
Yeah.
it shows the same number of
Yeah.
positions. That's why I was just trying to understand that. Just, for this year, this year from last year, it does look good. I was just looking back a little further and noticed there that we had 5 people 5 years ago, and it was 220,000. So I wasn't sure what was going on there. Was it like higher rank positions? Yes.
Just as, like, I mean, it could have been budgeted for 5 people. It could have been, I mean, there's a lot which goes into that number. It's very hard to track or do the trend analysis the way
You know
you're
what?
trying to do
I'm
it.
sorry, you probably also, you forget there's a lieutenant in there too, so that's part of his cost.
And someone could have
too.
moved out to another department. It doesn't mean that we didn't budget for 5 people. It just means the actual spend for that year was 223.
Because we got a lieutenant, a patrol officer, and you got 3 civilians.
So it sounds like that the issue here may be that the 5.0 headcount to the $200,000 spend in 2021, that would be only like 40,000 per person. That might be, something might be off there to explain that, right?
I don't know if those numbers are accurate.
Or it was partially funded through another
Yeah, well, I
department.
mean, it could, like we talked last time about someone out on workers' comp getting reimbursed, that money goes back in, someone moving from this department to another department. It doesn't change the fact that we still originally budgeted for 5 people. It just means throughout the course of the year, the actual line for whatever that employee did or moved or got transferred or whatever happened could be that case. So I don't remember what happened in 2021 to
I don't
give
recall anybody-
context to that.
I don't recall anybody being out. I have to go double check it, but 2021, I was
Yeah.
here, I just don't recall. you know, so.
It's something, this is my first time going through, and one of the things that helps me is accurate head counts to the funds, because then I can look and ask those questions. So I appreciate you looking back at that. I have one more question, if that's okay, and I appreciate you taking the time and giving the answers you can now and looking into the questions that we may not have answers to, so thank you. Skip into page 55, the police traffic department.
Oh, you know what, just to clarify. It's
absolutely.
possible that at that time, the captain was being budgeted in there, and he was moved under admin. So that could be, that's over 100,000 right there.
Okay.
So that's possible what happened. I have to double check that, but I think that's.
Something happened.
Yeah.
Yes, that's why I was asking. It didn't look normal, so
Yeah.
thank you. Yeah, so page 55, the line item ending 6157, which is gas and oil. So is police traffic, is that basically your garage? Is that handling gas and oil for all the patrol cars and cruisers? Because I don't see it in the patrol division side.
Yeah,
I
it's
didn't.
traffic division.
Yeah,
Correct.
it's all your officers, oil and gas.
Correct.
Okay.
Yep.
That was the question, so thank you.
Through you, Mr. Chairman.
Go ahead, Ms. Shake.
Thank you. Page 56, police professional standards. For the line of education, the 014786001, $240,000. Chief McNeil, if you could give a few examples of what education and programming opportunities that is covering for our police officers.
The main part of that budget is to cover certification, recertification. We have to do mandated hours by the state of Connecticut. This year, I think we're at 44, so that covers all the mandates, domestic violence, rape crisis, everything you possibly, any mandate that comes down. Like yearly, we have to do NCIC training. It's all the costs that come out of that. Also psychological testing, which is an unfunded mandate that comes in. So everybody that's in the certification period has to get a psychological exam, that was 20,000 in itself. 10 to 20,000, I say. So these are all the costs to maintain that certification and anything extra we do. So if we have an officer we want to send to a fatal course and how to do fatal accidents, it comes out of that budget.
And you said for the psychological evaluation, is it $10,000 to $20,000 per officer? That's the total to cover 100 officers?
Total. And it varies because this is a heavy research period, and next year we'll probably go down to 30 or so, or just shy of 30. So it varies, but we got to get them done. Plus we're in drug testing too. That's also a mandate.
And then just for my clarification, so I'm in a different labor sector. So when the police officers have to go through their recertifications, how long are those certifications good for? 1 year, 2 years?
3 years.
Thank you.
Go ahead, Ms. Gibson.
Through you, Chair. Thank you. First, I would like to just say congratulations to Lieutenant Eller for retiring. He did a lot of work with us in the south end of Stratford, and we appreciate that, so congratulations to him. And so I noticed on page 56 that there was a change in the head count. So was that due to retirement?
Correct.
Okay, all right,
So we had to streamline.
Okay,
so.
all right, thank you.
All right, I think we're concluded. So thank you for your time, Chief McNeil. Get back to work, keeping us safe. We appreciate your efforts.
Thanks all. Have a good evening.
Thank you again.
Fire Administration, page 47.
Make sure everybody can hear me. Good evening, Council. Pleased to be here with Deputy Chief Buck to present our budget request overview. Our budget overview is relatively flat. We've had a few significant changes based on contractual obligations and the higher costs associated with goods and services that we've accounted for. We reviewed the budget to make sure that it matched our collective bargaining agreement, and what we tried to do is look at the annual experiences that we have in review to decrease the amounts that were able to be decreased that we felt that were important. So with that, I'm open to any questions. We can start off that way, however you feel comfortable in doing so.
Thank you, Chief. So we're now open for questions on fire administration, which I believe covers 3 pages. There's administration, suppression, and prevention. So again, as we ask the questions, just feel free to reference the proper page numbers. And
Hi.
Go ahead, Ms. Gibson.
Thank you, Chief. I would just like to ask the question, has the fire department had any surpluses or deficits between 2023 and 2024?
We've stayed pretty even through there, so there's no surplus or deficits. We're right at the part where we need to be. We're relatively lean, so when we look at the budget, we ensure we're looking at past trends and future trends based on contractual obligations, so that way we stay right in the range that we need to be, where there's no surplus or deficit, and we're usually right on the mark, relatively lean.
Okay, thank you. Thank you for that answer.
Ms. Shake.
Through you, Mr. Chairman. Thank you. Good evening.
Good evening.
We've asked this question to essentially every department. So does the mayor's proposed budget allow the fire department to deliver the same level of services as years prior? Will it limit or expand the capacity or quality of your department's service? And if so, in what ways? But you described it was essentially flat except for several issues.
Yes. The mayor's proposed budget does account for our needs. We work together, like I said, we look at those trends, we review the trends to make sure that we're on target. So with the budget that we have proposed and the mayor's proposed budget, we're able to meet those goals. And what we do, we have an amazing group of people who are innovative, and they're able to look at ideas that are cost containment. And we really work together with our project groups. So we place our project groups there to help us find the things that save us money and ways that we can improve efficient services. We've done that through town hall meetings with the department to seek input from people. So instead of us just, oh, we're just gonna randomly do this, what we like to do is put our groups together and put their minds together, and that helps us be innovative and be cost effective at the same time.
Mr. Frier. Through you, Mr. Chair. Chief Atkinson, thanks for being here today. My question is for page 48, and it's going to be specific to line item 014626061, education. I'm going to reiterate this again. This is my first time here, so I'm trying to understand the trends from FY21 till present. Could you explain to me why in FY23 the request was $47,616, and then it doubled in 2024, and now in FY25 the request is $90,000? I just want to understand the ups and valleys of this.
Sure thing. Historically, this is a contractual obligation that education classes that the department covers for members to increase their education. And historically, back in 2021, what we would do is we're budgeted a certain contractual amount, but we found historically we weren't using that. So we weren't using that amount. So what we really tried to do is increase, through the contractual obligations, increase the amount of covered tuition classes for members to take. So by increasing that class, we decided to budget for it. But like I said, we looked at the trends, so we backed it down a little bit based on what we're actually using. Some of the fluctuations also come into place with new members being hired going to the fire academy. So based on attrition or people retiring or people leaving the department, we may have additional expenses there. So we found that 90,000 was an appropriate number. We're between that and the mayor's proposed budget. We found that that number was appropriate for our needs, and that accounted for those trends. In this last contract, we've increased those classes, and we found that many people are taking advantage of them, which, like I said, that leads to us being more innovative and finding the ideas. We find that people who are, we have a young department, they're hungry to learn, so we wanted to reward that hunger to learn, and we find that we're better off operating in the field for it.
Thanks for answering my question.
You're welcome.
Ms. Whittam?
Hi.
Good
Through you.
evening.
I love you guys.
We love you too.
I had a fire in my house, and they were all there, all 22 of them on that night. So, I really just have two questions. One's a general question for all 3 pages, and it has to do with payroll regular. Just the percentages increases on all 3 of your pages just seems high to me, and even though you're priceless to me, but just wondering where that's coming. You know, it's like $205,000 increase without any additional employees.
That's due to the contractual obligations. As we look through, we have step raises, we have contractual raises that was just negotiated into the contract, so we're accounting for those.
Okay.
Those sections in there, and that's what that is.
And what percentage, are they getting different percentages based on how many years of service or whatever you guys go by?
Yes, those are the step raises that come into play, but the contract, 2.65, thank you.
Thank you.
And that's, what that does, it goes through the department, and by going through the department, that increases that cost.
Okay. And then just one other question for page 48. And it is the uniform allowance. I noticed that nothing has been used yet this year. Is that get, charged to the right account later on in the year? Are you buying new uniforms? Is it just maintenance? What is that?
Yes, that's coming up right now, so that's got to be paid out by April 15th, so that's why it hasn't been used yet. So it was increased in the contract.
Perfect.
And we just completed our uniform policy, and this will be coming out soon.
Okay, thank you. Thank you all for doing a great job.
Kim says that'll be next week, so
Next week.
it's on our desk.
Yeah.
And thanks, Larry. You were there that night, too.
Go ahead, Mr. Glad.
Through you, Mr. Chair. Sticking on page 48, the payroll supplementary, this year's request is the same as last year's, but your year-to-date is, you're at 120.2% already. So just why is it the same as last year if you're already overspending? And we understand from the police, the supplementary piece can change. So just if you could clarify that a little bit.
That's the same thing. So in 462, let's see. Oh, this is, okay, yeah, this is the one right here. I got a note for that one right there. This difference in here was due to that holiday cash out. We had an assistant chief retire, and they had a holiday credit cash out, which is unused time, and a sick time cash out, which brought that higher amount. So based on the amount of time that people have banked, that rate will fluctuate, and that we try to account for that as well.
Thank you.
Mr. Frier.
Through you, Mr. Chair, to Chief. I'm going to be also citing page 49 and specifically line item 01463-6003 payroll regular. I just wanted to better understand. From my pamphlet, I've been able to see the wage scales, and I wanted to understand which positions are paid for via this section for the 5 headcount. Are they non-union positions or union positions?
These are all union positions because, except for, well, this is the fire union, right, so it's just a separate union. So these 5 positions are budgeted for the fire prevention office. So the fire marshal, 3 lieutenants of fire prevention, and the secretary in that office.
Thank you.
Sorry, three, Mr. Chairman. So, Chief, just to clarify off of what you just said, so those 5 positions, they are union or they are not union?
They are union. The secretary's position is through a different union from the local, but they're all union positions.
Thank you. And then going back to off of what Councilor Freeh was referring to with the education line item of $260,000, I think that's what he said. So is that similar to the same structure as the police, where it's not just tuition, is it certifications that the firefighters have to go through every X amount of years in addition to other education opportunities? Is that all lumped into that one lump sum? If you could just explain it a little bit more detail of what exactly that is.
Sure thing. Our tuition education is contractually obligated to each member. So each member receives up to $1,750 for tuition reimbursement. That can be used for classes, that can be used for certification classes, that can be used for higher education, and it can also be used for conference reimbursement as well. So we lump that all into one, and we also, at times, will pull a class for the entire department and pay for that to continue their certifications. So we do that as departmental training. One of the newest things that we've done is autism training. So we find the trends in the community, things that people need assistance with, and we pay for that and put our members through that, and we use that entire amount to do education for them.
Thank you. May I ask another question? Does anyone else? Okay. With the shift to shift or shifts, if you could describe what time the shifts are and how many firefighters are required, if you have, whatever the language is, a corps, of how many you have.
We have a minimum manning in our contract of 22 firefighters per shift. They work 24 hours on and take 72 hours off on a rotating schedule through 4 stations. When we have someone who calls out sick or uses their earned time through their contractual requirements, we fill that with overtime. Sometimes the overtime goes higher based on the step raises or the rate of pay that they're at. So it's not actually more people, it's just a higher amount based on the contract getting higher as we go through the cycle on that. I think that answers. Does that answer it? Is there one more part?
I'd have to think about it for a second. It was a loaded question, I'm sorry. I was asking about the shifts, if you could define what you said 24 hours is a shift. So when a firefighter comes on, it's they're there for 24 hours.
Yes.
Okay, and then they have 72 hours off.
Yes.
And then they come back for another 24.
Yes. They rotate. It goes 7 to 5 and 5 to 7. 7 a.m. to 5 p.m., 5 p.m. to 7 a.m. for their 24-hour shift.
It's a long shift. So with the staffing ratios and the shifts requirement of how many people need to be on, how many firefighters total do you currently have?
We have 99. It's my list here. Stand by. Yeah, I can break it down by line for you. So you have 92 firefighters on the line, 4 in the fire prevention office, myself and the chief, deputy chief, and 1 captain, for a total of 99 on our staff.
And is that the same or plus minus last year?
We're one over from last year because we have a new hire in the academy just to account for the retirement.
Thank
So
you.
we're fully staffed according to our contract, and we're coming up with a new entry-level exam, so we're looking to get some more fresh people on board.
Thank you very much.
You're welcome.
Mr. Aurelia.
Yeah, just a quick comment through the chair. Chiefs, thank you for presenting a reasonable budget, like the police department. And again, I looked at your year-to-date numbers, and thank you for managing your budget. Doing
Thank
a good
you.
job.
Appreciate it.
All right.
Especially to the chief. Yeah, my right-hand man right here.
Mr. Green.
Through the chair, I was, just wanted to thank you as well, echo Councilman Aurelia's comment, and I did want to look on page 48, the line ending 6024 for callback. I do see that it's pretty stable, especially going back 4 years there, but I also noted that it's such a large portion of the payroll compared to looking at the callback for the police department and things like that, and structuring it that way. That is time and a half pay, right?
Yes, it is.
Is that how other fire departments around us are managing the payroll? They have that much of it on sort of time and a half pay, that much of the payroll there?
Yes, a lot of that comes from contractual shift replacement obligations. So we have sick time, holiday credit time, and we have a lot of people, senior people, with a lot of time. So that's where that budgeted amount comes into play. And we look at it, we make a projection on that. We look at, got a note here, our line positions. So we look at the projected line staffing. We review the average of sick days and balance the overtime costs of a top step firefighter. And we look at the trends of holiday credit, sick leave, vacation, and education days. And we look at that as a total, and that's where we get that number from. So it's not a random number. It's pretty steady because the contract is pretty steady through the years, so it generally stays along that line with that.
It does look steady. I guess the question was, we are fully staffed to maintain these ratios right now. If we did increase staff, would it bring that number down in a way that would make sense long-term, or no?
I don't think so. I think those numbers would still stay around the same.
Any further questions for Chief Atkinson? All right, thank you very much, Chief. As we said to Chief McNeil, continue doing a great job. Thanks for keeping us safe, and we're going to do what we can for you. Thank you.
Thank you. Thank you all.
We'll do communications next, page 50. It's just one page.
Good afternoon, good evening. I am J.P. Trzynski, Superintendent of Dispatch. To my left is Heather Edmonds, the Supervisor of the Department. As you know, the budget's in front of you. It's a $78,000 increase year to year, and our budget's there, and I'd be happy to take any questions.
Open for questions on page 50. Go ahead, Ms. Gibson.
Okay, through you, Chair. Thank you all for your service as well. Just the same question I asked every other department. Has your department had any surpluses or any deficits in the year 23 to 24?
In the current fiscal year, we'll probably have a deficit due to overtime because we had someone leave to go to a different town, and it takes about 10 to 11 months to get a dispatcher up and running. So we had an increase in overtime. So we'll probably have a slight deficit this year, but we're trying to manage it with the other operational spending.
Okay, thank you for your question. I would like to ask you later on about trainings for dispatching.
I'll be here.
Thank you, thank you.
Sorry, Mr. Refria, go ahead.
Through you, Mr. Chair. Thanks for being here today. I'm going to be sticking, to, like we said, to page 50. Does the mayor's proposed budget allow EMS to deliver the same level of services as years prior?
I'll let EMS answer
Communications,
that, but-
yeah. EMS is going next.
Sounds good.
As far as communications, 911 dispatch, yes, it does.
Through you, Mr. Chairman.
Go ahead, Ms. Sheikh.
Thank you. Good evening. I just wanted to make more of a comment. I want to say thank you for your description and your highlights. It is compared to other departments that we have been speaking with, it's much more detailed and gives a good description of an overview so that I think it answers many questions that we might have had, so appreciate that ahead of time.
Absolutely, thank you.
All right, last call for questions to our dispatch team. Go ahead, Mr. O'Neill, and then Mr. Aurelia.
Through you, Chair. Just a question on the printing and stationery, the increase from 2023 to 2024.
I'm sorry, the beginning of that question? I apologize.
My question is about the increase costs for your printing and stationery.
From 23 to 24?
Yes, sir.
Ink cartridges. We have a printer that's about 10 years old, and knock on wood, it's still working. However, the ink cartridges are about $400 each now, and because we use NCIC printers that print out actual, pictures and data, we do require color printers. So we don't use a lot of ink, but we do have to spend some money on those cartridges.
Thank you.
Mr. Aurelia.
Through the chair, same comment. Thank you for the budget that you prepared, and looking at your year-to-date, you're doing a good job managing it, so thanks.
Appreciate it, thank you.
Mrs. Whittam.
I agree with what they both just said. Just a question on the regular payroll. Seems to have gone up a considerable amount with staying flat at 15 head count.
Which are you referring to from 24 to 25?
Yes.
So we had 2 or 3 recent hires, and so the step increases are what's adding also to the cost of the year-to-year cost of living increases. So the cost of living increases is 2.3 per the contract, and we have numerous step increases for 2 or 3 of our newer dispatchers, and everyone else is at top step.
Through you, Mr. Chairman.
Go ahead, Ms. Sheikh.
Thank you. So just to clarify, the head count says 15. How many positions are within the communication center for that payroll line item?
Sure, thank you. We have myself as the director, superintendent, Heather as the supervisor, and then we have 12 dispatchers and 1 vacancy.
Thank you.
All right, thank you again, keeping us safe. We do appreciate your efforts, and thanks for coming out and seeing us tonight.
All right.
Absolutely, thank you.
Thank you.
So we saved the best for last. Page 64, emergency medical services.
Mr. Chair,
Yes, go ahead, Mayor Hoydick.
thank you. Larry, would you like to share the good news about Mike with the council? That he was named?
No, Mike can do that. You can do that.
No, Larry, you do it.
So Mike Louise is extremely involved at the state level. He does a lot of things, including promoting of the EMS organizations as a whole, not just ours, to get the right kind of reimbursement for insurances and all that. And he's just been named the national EMS coordinator. advocacy coordinator of the state for the year.
Thank you. All right. Good evening, everybody. After putting me on the spot like that.
table's set.
Now deliver. Okay, so you have our budget. It's pretty flat and lean. It does, as the mayor's proposed budget, does allow us to operate unchanged from previous years. And we monitor that weekly, monthly, quarterly, just to make sure if we need to, go to Chris, Larry, or the mayor to request a change or something like that. So we're always on top of, where we are. I can tell you that we had some challenges this year. One of them was, inflation and supply chain management issues. The other one was staffing. You can probably see that reflected in surpluses in payroll under per diem, EMT, and paramedic, but you can see the alternative of an increase in overtime as well. So that's, we have to come up with really creative ways to move things around, including but not limited to monitoring our actual call volume, because we don't actually have a minimum staffing clause. So in order to address staffing issues effectively without degrading any response to the community, I regularly monitor where our call volume is, what time of day that call volume is, and then I do that by day, so that if we decide that, let's say we're going to be okay with not filling an ambulance for the day that we would normally have staffed, we know what that projected impact is going to be on the town. Or we say, this is one of those shifts where we can't drop a car, we're going to keep the car on, and then we might have to go to overtime or try to figure something out. So those are things that we do on an active basis. Ultimately, though, we did see some positive enhancements to our budget this past year. We were able to reduce our regional radio communication costs by about $50,000. We were able to eliminate our hospital linen costs by $8,000, and we are still working on reducing some of our billing costs as well. So that's kind of where we're at, and I'll take any questions that you have at this time.
All right, thank you. Again, on behalf of the committee, congratulations on your recent recognition. It's then another thing for the whole community to be proud of. Go ahead, Ms. Gibson.
Congratulations, and thank you for the great service. I have a job where I call 911 often, and I know it's really challenging. It's in another city, though, but yeah. So my question is the same question that I asked the other departments. Has the department had any surpluses or deficits? And you did explain that you saved some money, so I'm wondering.
Yeah, so again, the surpluses, some of them, like the surplus that you might see in per diem staffing, is kind of a, I don't like to cheer for that one, because in order to take care of the town properly, I'm going to have to backfill that with overtime, right? And we might have, challenges getting volunteers in or whatever the case may be. So we have to be really creative in the way that we monitor and fill these shifts, given the fact that we don't have a minimum staffing clause. But again, we were able to see those surpluses on the operational or expense side through our CMed or our regional communications system and linen. We see other expense increases by way of consumable supplies. This is where most of our medical supplies come from, and because of supply chain management issues and inflation, some of those went up. In the meantime, one of them that we struggled with, there's a particular medication that is very expensive. We were forced to kind of use that for a period of time over the last year, we were able to pull that back and go to a different, equally effective medication, but a fraction of the cost. So we do things like that all the time throughout the year when we get hit with those challenges.
I can appreciate that. Another question, just briefly, since you brought up medicine. So the Narcan, do you use that, and do you get that through state funding, or is that part of the budget as well?
Yeah, we've, EMS has used Narcan forever.
Okay.
I've been doing this 34 years, and it's always been in our toolbox. But we don't necessarily get state funding for that. What we did recently get is there is a requirement that the state is not yet forcing us to do, because we're not quite sure how to do it, of participating in the Narcan leave behind process. So we did get a whole bunch of free Narcan kits for that purpose. We just need, OEMS, the Office of EMS at DPH is coming out with some rules of engagement of how we're going to go about doing that. And it's very limited supply.
Okay, thank you for that. Appreciate it.
I just want to remind everybody that EMS is an enterprise fund, so their revenues are to match their expenses. So it's not treated as if it's the police budget or the fire budget. Like that's why they monitor it way, so they can hopefully have net neutral at the end of the year.
Through you, Mr. Chairman.
Go ahead, Ms. Sheikh.
Thank you. And Ms. Chimniak, to that point, the revenues and expenditures were virtually within, I don't know what the percentages that you're aiming for your budget. Perhaps you could explain that to us then.
So it's a difficult question to answer because, one, we hope that nobody's calling 911 to be picked up. I said it's a difficult question to answer because, one, we're hoping nobody calls 911 to pick up. When they do call 911, there's an entire billing process which goes through for every town resident, through the insurance company, through our collections. They can get more into that. But if they staff the shift and nobody calls, there's no revenue coming in. So we'd be operating at a deficit for that particular shift. And then you don't get that money back. At the end of the year, it goes to the EMS reserve fund, and if the revenues don't match, they pull from that, which gets a little more complicated in the finance world, which Kim can talk a little bit about that if you want to get into that. Does that sort of answer your question? It can get an in-depth, like 30-minute conversation sort of in my office if you want to get into the nitty-gritty of it.
That's okay. I'll ask. Perhaps Michael can.
One other point
answer,
about
or Larry
that.
could answer the question. Thank you.
To one other point that what Chris has mentioned, the delta or the amount that the town contributes is trying to be as equivalent to the amount that they provide for in-kind services within our community too. So it's not just that they live on revenue that's generated, they're also performing services unbillable to the town. So we try to match that delta to that unbillable amount.
Do you have a number, like a?
It's somewhere in a $400,000, $450,000 a year range.
Yeah, we put 450 in the budget, and that's coverage. So when EMS goes and they cover Blues on the Beach, or they show up to a high school football game, or they show up to a large event and they have it staffed with an extra ambulance just to be on location where there's a lot of congregation of people. That's the town paying for that because we understand that there may or may not be a medical call, but we want to have the service to the resident.
Thank you. So, in other words, the town is subsidizing a cost that we are creating because we're holding events. These are not just general emergency situations where people are calling for help from their home or place of business. I just want to be clear. Is that correct? Would you say that? So, in kind of, right? But because we have all these events, the town is paying for their services to be available if necessary. So thank you for clarifying that. You don't have staffing ratios, is what I heard, correct?
I don't have minimum staffing requirements.
You don't have minimum, what does that mean?
Yeah, like I'm not, there's nothing that says that, like, let's say I have to have X number of people on. I suppose, I might like that at some point, but right now what we do is we staff according to, or we try to staff according to what the volume of the town, the needs of the town say. So it would be great, right, if I was like Greenwich and I can put 5 trucks on days. We'd never pass a call ever, right? But the volume doesn't say we need 5 calls on. It maybe says we need 3 or 4 calls on. So we recognize the fact that there might be some mutual aid in town and all that kind of stuff, but generally speaking, we try to put on enough ambulances to serve the town properly. And if some kind of staffing issue comes up that doesn't allow for that, then he and I go into the office, we crack out the board, and we try to figure out ways to meet the town's needs in other creative ways. Sometimes he and I will jump in a truck and go take a call or two just to diffuse the system. Sometimes we can get volunteers to come in during the day. It's rare, but we can sometimes do that. So we'll try a bunch of different things according to what the volume of the town is.
Do other municipals of the same population size have EMS services that function in a similar way that Stratford does in Connecticut? Yes?
I would say the enterprise fund is probably the most unique thing, but other than that, operationally, sure.
Has the town been has EMS been in a situation where we don't have enough staffing and for whatever reason it's unable to get out onto the scene? Is that where mutual aid steps in, or is that where the fire department has to step in?
Yeah.
If you could just explain.
Yeah, so
that.
we do 2 things. We are required by the state to have mutual aid agreements in place, and that is enumerated in our town's EMS plan. So we have agreements with Nelson, with AMR, with Shelton, with Trumbull. We even kind of, have sort of generalized agreements with Milford and so on and so forth. So if for some reason we had like a staffing crisis that impacted our ability to put an ambulance on the road, then like I said, he and I would go to the drawing board, try to figure some things out. Let's say that failed. Well, now we've got mutual aid coming in. So there's never really going to be a time when the resident is completely left out to dry. Obviously, mutual aid is not as great as having your own in-town ambulance because they may be coming from further away or something like that, but the care that's rendered is the same. We're all using a statewide protocol, so there's no difference in the ability to care for the patient. And so, we have that kind of fail-safe in place no matter what.
May I ask another question? Just to follow up. So with the staffing that you do have, with no minimum, but there's still staff available, are you required to have a paramedic versus an EMT always on?
We require that. There's nobody at the state that, like, we couldn't just, we have what's called a primary service area agreement. This is, or a primary service area assignment, PSA. This basically means that the state is giving us the ability to be a paramedic service by providing those services. If we couldn't put a paramedic on for, let's say, a period of hours, we would just use mutual aid and there would be no problem. If we couldn't put a paramedic on for several weeks, that could be a problem for us. So we have established our own internal policy that we will always have at least one paramedic on. Now, sometimes if we have, a major problem, and we haven't had this in many, many, many years, and it was a very brief thing, I could use him. Like, if we want to give the staff a break instead of ordering them in or forcing them to be here or something like that, for a period of time, I can be like, hey, can you just cover it for a little while so we can give it, let's say we're hammering them too hard, it's just been really busy, et cetera, et cetera. We can do things like that. So we have a lot of different tools at our disposal to make ends meet when we need to and to be creative with
Thank you for clarifying that. That's helpful. I'm just asking because the line items for the per diem paramedics and the per diem EMTs is almost $500,000. So how that trickles down into what your department is providing.
Yeah, some
Substantial.
of it is contractual, some of it is, you know, not having as many volunteers as we used to, and still trying to maintain that, you know, that coverage according to the needs of the town.
Just one comment. I get a report every day on their staffing, and I give these gentlemen a lot of credit when they went to an effective staffing model where it went against the call volume instead of a square, straight model. That allowed for better coverage of the town when it's needed and also allowed for better flexibility in the staffing. So I see their staffing every day, again, report every day, and it's they've done a really good job of managing a slight downturn in staffing. Now it's up and running very effectively right now.
Mr. Green and then Mr. O'Neill.
Through the chair, I just wanted to extend my thanks to the entire Public Safety Department, Larry and all the chiefs. You all made yourself accessible to me, from ride-alongs with Stratford PD to ride-alongs with EMS, going through all the ways in which you're working individually and as a unit to deliver the highest level of service for the town in a way that's responsible to the taxpayers. Thank you also for explaining the unique structure of EMS as an enterprise fund, and right, I think it is important for us to note that all these services you're providing at a cost to the town that's directly about 10% or so of your actual budget. The rest you're handling on your own. I did want to ask how the EMS reserve fund, what is the current level of that fund?
I'll have to get back to you on that. I'll have to ask Dawn specifically what that is. We'll have to look that up.
Okay. And
Yeah.
I know we do have, also to you, Chris, some other funds listed here, I think on page 66. Will that be a part of one of our workshops here, or this was just included for informational?
So I did EMS because it's a larger group. In years past, we haven't had a discussion about the dog fund. We haven't had a discussion about Short Beach. A lot of those are sort of housed in whether it's police or Public Works through Recreation. Most of those employees have already been covered through the other departments. So what you're looking at is basically the offset revenue lines in here and how it's put together.
Okay. Especially since 9 of us are new on the council and we have one workshop remaining, I think a quick review of that could be helpful for all of us. I'm glad to see so many of my fellow councilors. We're asking these questions because we genuinely want to make sure we understand what's going on. So thank you.
Through you, Mr. Chair. Just a quick question in terms of response time. Since we're not having a mandate of personnel staffed per day, and like you said, AMR or Nelson has to come, what is your the average response time, and then what has been your longest response time?
So we look at response times in EMS in 2 ways. We look at what's called a priority 1, which is like your life-threatening lights and sirens going and all that kind of stuff. And then we have a priority 2, which is no lights and sirens, go with normal traffic. As an example, if we were to get a baby choking, I think everyone here can agree that we should be responding with lights and sirens, right? But lights and sirens creates risk to the public. I can crash into a family of, I don't know, whatever. That's scary, right? We don't want that. So for a stub tow, right, if somebody calls 911 for a stub tow, I'm not going to have my ambulance going lights and sirens to that call. They're going to go with traffic. They're still going to get there. They're still going to be able to provide excellent care. And that's all enumerated in our EMS plan, and with the Office of EMS, they support that, and so does our local hospital medical control system. All of that stuff is kind of pre-figured out by the dispatch center when they're doing the emergency medical dispatch process, and it kind of automatically comes out and kind of tells us how to go. So our average response times for an emergency lights and sirens call is anywhere from probably 5 to 7 minutes, which is well under, there is no legal national average, but it's well under what EMS providers across the country feel is a reasonable average. And then for our non-emergency response times, it's probably around 11 to 12 minutes. When we're doing mutual aid, one thing that I do that nobody else does is I track our mutual aid providers coming into town, and I give them a scorecard at the end of the year. So if AMR does, I don't know, however many calls, I want to see, and this is an arbitrary number that I created, I want to see them getting here in 12 minutes. I don't want to see anything more than that. I give them a little leeway because they might be coming from another contiguous town or something like that, but I hold them accountable to a 12-minute response time. And then if I don't see that, I'll give them a call and say, hey, what are we going to do to fix this? We need these response times improved. They've been very good and consistent with us. We actually also use, as I said before, mutual aid from other towns like Shelton and Trumbull. We may get slightly longer response times from them. Sometimes we don't really have a choice but to use them, but we monitor all of that kind of stuff on a regular basis. The other thing we did probably in 2011 or something like that is we put an ambulance during the day up in Oronoque. So the firehouse, the fire department has been gracious enough to give us a room up at the Oronoque Firehouse. So during the day, 7 days a week, anytime we have 3 cars available, we send a car up to Oronoque to keep response times up there, down, because our town is so tall like a boot, and we're sort of in the middle lower end, so it takes us a little bit longer to get all the way up there. Putting that car up there during the day allows us to keep response times down and serve the community better.
One other point of that, too, is that you have to recognize that it's not just about EMS's response, it's how dispatch gets the information out, and they're getting that out, and they're responding to calls on average of 10 seconds or less on a continual performance spectrum. So their performance has a lot to do with all our public safety teams rolling out effectively, getting the correct information, perform whatever service on scene is necessary.
Yeah, I mean, thank you for that. The reason I was asking is because when I was on the council before, it's still about the same 12 minutes, 7 minutes, for average, but 17 minutes before I recall, was a difference between almost like life and death of a person, so that's why I was asking.
Yeah, it can be, and we, like I said, we monitor that stuff on a call-by-call basis. We actually have a screen up in the duty room where the staff are that is telling them in real time what their response time is so they can compete with themselves. And then he and I monitor that every single month, and then we report back to the staff. If we have a really extended response time, that's not going to happen without he and I having a discussion, doing a whole incident report on it, getting all kinds of, we have to report all of our response times to OEMS every single month.
One of the things I do want to add too, we have a great relationship with Chief Buck and Chief Atkinson. So we talk about EMS, but it really is a tiered system. So if a certain call reaches a certain threshold, it's not just the ambulance responding. You have first responders who are providing basic life-saving care to, I don't want to call by the time, but they're stopping the clock, if you will, until a transport unit arrives. So as a whole, these calls that either have a significant delay like you're referencing from years ago or now are at such a small number that we have a really good handle on it. So like the whole system as a whole is very responsive, very robust, and we could not do it without our partners behind us, so.
Thank you.
Through you, Chair. This is just a question about volunteers. I have some friends in Westport that were volunteers through EMS, and I was just wondering, in the future, are you going to expand on the volunteers? And would that really help the budget, or, how does that work?
So the concept of expanding volunteers would help the budget, but we have always been trying to expand the volunteers, and the pool is just no longer there. That's the problem. It's a problem in Westport, it's a problem here, it's a problem everywhere in Connecticut and across the country. So we're constantly bringing in volunteers. We never take our volunteer position announcements off of the website, so we're always open for new volunteers to come in. We do run the EMT class. At the end of the EMT class, I give each one of them an application and I encourage them to apply. I send stuff to the high schools and all of the colleges pretty much in the state to get people in. I think the biggest problem is with the cost of living and everything else, volunteering and doing EMS for free is really hard for people to do, or they are willing to do it, they come in, but they're doing it as a precursor to something else, whether it be transitioning to fire, transitioning to police, or moving on in medicine to, we have several PAs working for us, and we have 2 of our volunteers, or actually they're paid staff now, but they were volunteers who just became doctors, and they're gonna be moving on to their residency work.
Thank you for that answer, and seems like you're doing everything you can, and I understand that about volunteering. I'm a CERT member, so I really do appreciate everything you all do, and you've helped my family out quite a bit. Thank you.
All right, before we conclude for the evening, Mayor Hoydick has a brief announcement to make to us.
So it was my pleasure today, along with Mary Dean, to meet the Army at the Army Engine Plant, along with the developer, Point Stratford Renewal, where they did a ceremonial conveyance. The property was conveyed on Thursday, the 28th, and now is in the transition phase from the Army to the developer. So it's good news for Stratford. Long time coming.
Through you, Mr. Chairman.
Go ahead, Ms. Shake.
Thank you. Maybe last question. So for your payroll, how many full-time staff do you have? I'm just going to walk through all of them. So
So
full-time.
we have 10 full-time paramedics. We have 3 full-time supervisors. We have a secretary, myself, and Kevin. Am I missing anybody? That's everybody.
That's full-time and part-time?
That's full-time.
Just-
Part-time,
okay.
part-time fluctuates constantly. I would say we probably have 40 people altogether, and that
40?
doesn't mean they're all working.
40?
40. Doesn't mean they're all working.
How about your per diem paramedics?
That includes per diem paramedics. So I would say we have, what do you think, paramedic-wise?
Right now, we have approximately 5 per diem paramedics. That number used to be 10 or 15 at the beginning of the pandemic. Obviously, like everyone else, we've had the same challenges. On the per diem EMT side, we've seen numbers as high as 50. Right now, we're around that 30 number, 30, 35 for that.
33?
Approximately 35 for EMTs. Like I said, that number does fluctuate.
35 per diem EMTs?
That's correct.
We are aware that every firefighter is an EMT. I just want to make you aware that every firefighter is an EMT.
Thank you, Madam Mayor. So the firefighters count towards your per diem EMTs?
No, they
Okay,
don't
because
count towards us.
my question was for EMS
For
with your
EMS,
line
yeah.
item,
For
35.
EMS, we have
The response was directed towards if the service is delayed, as Kevin mentioned before, each firefighter is an EMT. I remember Brian Lampart explaining to Oronoke that you have the closest service right next door to you.
Right.
And every firefighter can sustain your life until the ambulance and the paramedics get there.
Correct.
So that's the point.
Yes.
Okay, thank you, and that is very important. I was looking at the line item of cost for your per diem paramedics and your per diem EMTs and trying to understand your total staffing of what you have for your department. So it's, it varies. Thank you.
All right, thanks again to our entire crew in blue, all of whom have stayed with us through the whole evening. And at this point, I am going to be recessing the budget workshop until Tuesday, April 9th at 5:30 p.m. Thank you.